how do you first go about treating an inattentive ADHD, which I don't know about you, but the majority of the ADHD I see, the chief complaints are inattention, trouble with concentrating. Doc, I'm not too restless or hyperactive. I have a real time being on time, motivating, finishing tasks, and concentrating, especially if I'm uninterested.
So I think opening up kind of, the different pathways of treatment, I think is important, and giving patients kind of the roadmap of the road, so to speak, is where I would start. So, we typically think of medication-based treatments and non-medication-based treatments. And both of those may be first-line agents. They may be things that are equally effective, but they are things that some people prefer medications, some people prefer non-medication therapies, and perhaps many people would do the best in kind of combined, combined method. So we think about medications, whether they are stimulants or non-stimulants, and we think of talk therapy, specifically cognitive behavioral therapy, as being perhaps, the best evidence-based methods for our patients.
So there is evidence-based therapies for ADHD.
That's correct.
Just because you have ADHD does not mean that the only answer is just medication.
Sure. So cognitive behavioral therapy is talk therapy, a flavor of talk therapy, so to speak, or psychotherapy, that essentially examines the relationship between thoughts, emotions, and our behaviors. It's something that is potentially useful in a wide range of different psychiatric illnesses or disorders, mood disorders such as major depressive disorder, bipolar disorder, anxiety disorders, and essentially gives patients, a sense of kind of introspection or insight or thoughts or skills training kind of into their own behaviors and how they impact their lives.